Hi, this is Dr. Amir, your online health physician. Today we will briefly discuss a disease called hypertension, or in casual words, the blood pressure. So the question is, what is blood pressure? Blood pressure is the force exerted by blood against the walls of blood vessels and is measured in millimeters of mercury, mmHg. Basically, the two primary types of blood pressure are systolic pressure, the force when the heart contracts, and diastolic pressure, the force when the heart is at rest between beats. Are there any other types of blood pressure too? Blood pressure can be classified into various types based on different factors. Some common types include 1. Normal blood pressure, systolic less than 120 mmHg and diastolic less than 80 mmHg. 2. Hypertension, persistently high blood pressure, categorized as stage 1 or stage 2 hypertension. 3. Hypotension, persistently low blood pressure, often associated with symptoms like dizziness or fainting. 4. White coat hypertension, temporary increase in blood pressure due to anxiety or stress during a medical appointment. 5. Masked hypertension, normal blood pressure in a clinical setting, but elevated readings outside of it. These are just a few examples, and there can be other specific types based on certain conditions or circumstances. What are the signs and symptoms of high blood pressure? Signs and symptoms of high blood pressure may include headaches, shortness of breath, chest pain, dizziness, blurred vision, fatigue, irregular heartbeat, blood in urine, and nosebleeds. However, hypertension is often asymptomatic, making regular blood pressure checks important for early detection and management. It's important to note that some individuals may not experience any symptoms despite having low blood pressure. What are the signs and symptoms of low blood pressure? The signs and symptoms of low blood pressure, or hypotension, may include dizziness, lightheadedness, fainting, blurred vision, nausea, fatigue, rapid or shallow breathing, cold and clammy skin, lack of concentration, thirst, and weak pulse. However, individuals with low blood pressure may not always experience noticeable symptoms. Doctor, what are the precautions which I should take for high blood pressure? Precautions for high blood pressure include regular monitoring, maintaining a healthy weight, exercising regularly, following a balanced diet low in sodium and high in fruits and vegetables, limiting alcohol consumption, and managing stress, and taking prescribed medications as directed by a healthcare professional. Doctor, what are the precautions which I should take for high blood pressure? Precautions for high blood pressure include avoiding sudden changes in posture, staying hydrated, consuming small, frequent meals, adding more salt to the diet, wearing compression stockings, and avoiding excessive heat. And discussing medication adjustments with a healthcare professional. Doctor, does blood pressure affect my heart? Yes. High blood pressure puts strain on the heart by forcing it to pump blood against increased resistance. Over time, this can lead to thickening and stiffening of the heart muscle, enlargement of the heart, and increased risk of heart attacks, heart failure, and other cardiovascular complications. Proper management is essential to protect heart health. Doctor, Does blood pressure affect my sleep? Yes, high blood pressure can affect sleep. It can contribute to sleep disturbances such as insomnia, sleep apnea, and restless leg syndrome. Conversely, certain medications for high blood pressure may cause sleep disturbances as a side effect. Doctor, does blood pressure affect my sexual health? High blood pressure can have an impact on sexual health. It can lead to erectile dysfunction in men and reduced sexual desire or arousal in both men and women. Additionally, certain medications used to treat hypertension can have side effects that affect sexual function. Consulting a healthcare professional is advised. Doctor, do blood pressure affect in pregnancy? Blood pressure during pregnancy is an important parameter to monitor. High blood pressure in pregnancy, such as gestational hypertension or preeclampsia, can have serious complications. Regular prenatal checkups, monitoring blood pressure, maintaining a healthy lifestyle, and following medical advice are crucial for managing blood pressure during pregnancy. Doctor, does blood pressure affect my baby during pregnancy? Yes. High blood pressure during pregnancy can adversely affect the fetus by reducing the blood flow to the placenta, leading to inadequate oxygen and nutrients. This can result in growth restrictions, preterm birth, and other complications. Proper management is essential to protect the health of the fetus. Doctor, does children also affect by blood pressure? Yes, blood pressure can be observed in children. High blood pressure in children, known as pediatric hypertension, is a concerning condition that can have long-term health implications. Regular blood pressure monitoring is important, especially in children with a family history of hypertension, obesity, or other risk factors. Doctor, what should diabetic patients do about hypertension? Diabetic patients should take precautions regarding blood pressure by maintaining good blood sugar control, adhering to a healthy diet low in sodium and carbohydrates, exercising regularly, avoiding excessive alcohol consumption, quitting smoking, managing stress, and taking prescribed medications as directed. Regular blood pressure monitoring and regular checkups are important. Doctor, what are the risk factors for blood pressure? Several risk factors contribute to the development of high blood pressure, including advancing age, family history, being overweight or obese, lack of physical activity, unhealthy diet, high in sodium and low in potassium, excessive alcohol consumption, tobacco use, and chronic stress, and certain medical conditions like diabetes and kidney disease. Doctor, how does my smoking affect my blood pressure? Smoking can have a significant impact on blood pressure. It causes immediate and temporary increases in blood pressure, leading to higher systolic and diastolic readings. Long-term smoking damages blood vessels, promotes inflammation, and increases the risk of developing high blood pressure and cardiovascular diseases. Quitting smoking is crucial for blood pressure management and overall health. Doctor, how can I be diagnosed if I suffer from any kind of blood pressure? Yes, there are various tests to diagnose blood pressure. The most common method is using a blood pressure cuff and a sphygmomanometer to measure the pressure in the arteries. It is typically measured in millimeters of mercury, mmHg, and recorded as two numbers, systolic over diastolic. Automated blood pressure monitors and ambulatory blood pressure monitoring (UPM) can also be used for more detailed and continuous assessment. Thank you, Doctor. It was a really informative session. Wish to see you soon with other health topics. Goodbye. But before that, health tip for you. Adopt a healthy lifestyle that includes regular physical activity. Following a balanced diet rich in fruits, vegetables, and whole grains, reducing sodium intake, and managing stress through relaxation techniques. Getting enough sleep, avoiding excessive alcohol consumption, and taking prescribed medications as directed by your healthcare professional. Regular monitoring of blood pressure and regular checkups are also important. Please share your comment on today's session.
Please subscribe and like my YouTube channel, and don't forget to ring the bell for upcoming videos.